Hello, I'm back to continue discussing health, chapters 4 through 6, and I'm just barely getting to the very end of chapter 4, and I still got some things to say, so I may have to go back and do some editing on our YouTube to make it not be so long. I apologize for that. I was talking about cancer, childhood cancers, and I did find a statistic. I think I told y'all I like statistics, not that I like doing statistics in math, but I like learning about statistics. Anyway, cancer is the leading cause of death in children of diseases, from diseases. There are other causes of death in children, but I'm talking about death from a disease. But it's still rare for a child to die from cancer, even though it is one of the leading causes for children to die from a disease. But only 1 in children per 10,000 will develop cancer in a given year. So I'm just trying to give you, you know, some statistics about cancer. Even though it's the high numbers are there, it's only 1 in 2 per 10,000. So, but cancer treatments have been improving, and diagnosis children are getting diagnosed earlier, and there's an increased number of children that are being able to return to school. Another thing I already mentioned, anemia. Anemia is a blood disorder. It reduces the number of red blood cells that carry oxygen to the body's tissue, but it is a symptom of other things, such as sickle cell disease. The students that have sickle cell disease can have anemia. I'm sure students that have cancer can have anemia. Another thing that children deal with, as well as adults, but definitely children, approximately 1 in every 400 to 600 children has type 1 diabetes. Approximately 30 to 50% of those children are under 18 and are currently diagnosed with type 2 diabetes, which is the one that's often associated with being overweight or obese. The American Indian, African American, Mexican American, and Pacific Islander youth are at the highest risk for developing diabetes. Of course, like everything else, an early diagnosis and treatment is essential to reduce the risk of long-term health complications. And weight management is important, and so is monitoring dietary intake, and physical activity levels must be monitored carefully. I was going to tell you some facts about lead poisoning and seizure disorder. It says 2 to 4 years of age, children are at greatest risk for developing lead poisoning. And however, the incidences of lead poisoning has been decreasing because the sources, the things that cause lead poisoning, the things that children can be exposed to, are being identified and eliminated. Old paint on old houses has lead in it, but you know they've been able to identify that fact. But students that have problems with lead poisoning have elevated blood lead levels, which causes a variety of symptoms, such as learning and behavior problems. It's not something we see quite as much anymore, but it is something we need to be aware of. Seizure disorders. Approximately 2 million people in the United States, about 1 in 100, have experienced a seizure or been diagnosed with a seizure. 300,000 children are under 14, and children who have a neurological or genetic disorder such as cerebral palsy, fetal alcohol syndrome, or Down syndrome are higher risk of also experiencing seizures. The management of seizures, and this is something that they will go over with us, or at least in the past when we do the CPR and first aid, because this is something that as an early childhood educator, we are more likely to deal with children that have seizures in a classroom setting. but they last less than 2 minutes, and you need to call immediately for medical assistance. If it lasts longer than 5 minutes, or if the child has difficulty breathing, all of those things are things we need to observe about a child. And like I said, when we do the CPR and first aid, they go over, or at least in the past have gone over very well, how to handle children that are in that situation. Okay, if we go on to Chapter 5. Chapter 5 deals more with the communicable diseases that children are affected by. Young children experience communicable diseases more often because they have had fewer opportunities to develop protective antibodies. The immature development of their body structures, there's a shorter distance from their mouth to their nose, or between their ear to their nose to their throat, other than, than it is for an adult, of course. They are often in group settings, such as home and center-based early childhood programs in elementary school classrooms, and communicable diseases are infections or conditions that can be transmitted or spread from one person or animal to another. These factors must be present. Pathogen, susceptible host, method of transmission. Okay, your pathogens are bacteria, virus, fungus, or parasite. The elimination of one of these factors will interrupt the spread of communicable disease. So if something's interrupted in this cycle, it can interrupt the spread of the disease. The susceptible host can have a break in their skin, like a small cut that something can get in, bacteria. Things can get in the respiratory tract and the digestive tract. And woe be unto you if something gets in your digestive tract. It's not pleasant. Method of transmission. You can get infected by transfer from an infected individual through water, milk, dust, food, toys, towels, eating utensils, animals, and insect. That's an indirect contact. I'm sorry, I looked down and read too far down. That's an indirect way to get things to be transmitted from one person or animal to another. Airborne is things that are airborne, or usually you get, or like flu, colds, meningitis, tuberculosis, and chickenpox. This is the fun one, fecal oral transmission. Pinworms are transmitted that way, hepatitis, salmonella, and I can't pronounce that word, Giardiasis. I've got to look that one up. I'll know it by Thursday. You can be directly contacted by, ringworm is direct contact, athlete's foot, impetigo, hepatitis B, and conjunctivitis, which is pink eye. And like I said, you just need a susceptible host. You can be a susceptible host. Children who are well rested, and this would go for adults as well, adequately nourished, immunized, and overall healthy are generally less susceptible to infectious organisms. How can we control? What are the precautions that we need to take to keep from getting infected? Children need to be observed. The daily health checks, or the daily health observations that were mentioned in Chapter 2. Remove children who are ill from the classroom or eliminate the direct source of infection. And we talked about exclusion policies. We talked about the ones that were listed in the rules for Child Care Learning Centers, and there's some examples. There again, page 118 gives an example of an exclusion policy that's in our textbook. You need to notify families of the child's exposure, and there's a sample on page 119 of what a way to notify families. Teachers need to go by the same exclusion guidelines as children, because if a teacher has conjunctivitis or pink eye, then they are sick and ill and need to be excluded from the classroom. There is a checklist on page 120. It's checklist 5-1, and it's a checklist about how to administer medications to children. Once again, that was something that we discussed when we looked at the Georgia DECAL rules for Child Care Learning Centers. But that is something I want you to look at, because it is something that's a part of our health competencies. Also, there's a chart, figure 5.6, 123 in the textbook. It's the immunization schedule as of 2013. At the bottom of page 122 in the purple text box, there's some hand washing compliance information. And once again, when we looked at our rules for Child Care Learning Centers, there was a large section of hand washing rules of what is acceptable hand washing procedures. Another thing that will help keep from spreading diseases is frequent cleaning of furniture, toys, and surfaces. And also, especially if you're dealing with children that are diapered, sanitary diapering procedures. And you could also be in a situation, by the way, that's on that's 5.5-4, page 127. You could be in a situation where you're dealing with older children that are special needs that have to be diapered. So, you know, it's not just children. If you should happen to work in a nursing home where they're elderly, same thing. You could have elderly people that have to wear diapers because of not being able to control that part of their body anymore. Teachers have an ethical and professional responsibility to protect the wellness of all children in a group setting. Like I said, our illnesses are transmitted by airborne, fecal, oral, direct, and indirect contact. The stages of infectious illnesses are three. Excuse me, there's not three. There's more than three. There's the incubation stage, the prodromal stage. I think that's pronounced prodromal. At least that's the way it looks on this piece of paper. I hope it's spelled right. There's an acute stage and a convalescence stage. And we'll look more, you need to look more in the textbook about that, because I can tell you there's a question on the test about that. There are policies. We've talked about that in the rules for how to take care of, well, there's exclusion policies, cleaning policies, diapering, food preparation policies, and hand washing policies. All of those we've discussed, both in the book and the rules for Child Care Learning Centers. Immunizations of children must be current, and in most cases they can't come to school if they're not. Unless they do have, I can't remember what it's called. We talked about it in the other chapter. They have to have an affidavit, I believe it's called. Environmental measures. There are universal infection control procedures for handling bodily fluids, and this is rules that are universal. Rules for handling body fluids such as blood, feces, vomit matter, and there again, there's a checklist in the textbook that talks about that. We need to teach children how to correctly wash their hands, and we also need to be sure we're cleaning and disinfecting, especially in areas where food is being prepared, bathrooms, diapering tables, toys, and equipment. Here's another thing. Maintain comfortable room temperature in the classroom. Open doors and windows for fresh air. However, you have to be careful with those who have allergies. Take special precautions with sandboxes, pools, and water tables. Things can be transmitted through those. Okay. I think at this point it looks like I've got just a little bit more to go, and I'm out of time on this YouTube. So I am going to finish up on another one. I'll try not to take so long on that one. See you in a minute.